This is a health center in Nigeria. It was built to save lives, supported with foreign aid. But now it's empty. The medicine gone. The staff never showed up. And this is not an isolated case.
Smile, British sovereignty is surrendered to the Prime Minister. He said, Nigerians proudly acclaimed Queen Elizabeth as Queen of Nigeria, head of the Commonwealth.
When Nigeria gained independence in 1960, like many African nations at the time, we were filled with hope. We dreamed. Part of that dream was being able to take our future into our hands. We dreamt of hospitals with clean beds, of our babies being born into safety, and the world responded with aid. By 2000, aid coming into Africa was no longer a trickle, it was a flood. Across Africa, billions were pledged. Donors fought HIV, malaria, tuberculosis. The West said, we will help Africa rise. And in some ways they did. HIV deaths declined. Tuberculosis mortality and deaths by malaria has dropped by over 50% in the past 2 decades. Polio and measles retreated, but something else was dying. Only a few noticed. While some clinics glowed with donor funding, others crumbled. For example, a new HIV center opened, but the maternity ward next door had no midwife. A shiny lab diagnosed tuberculosis, but the pharmacy was empty. Aid saved lives, yes, but it created a rot in the system that was fueled by inefficiency and lack of capacity. Aid wasn't supposed to become a system. It was supposed to be a bridge, something temporary until countries are able to stand on their own. But over time, it became permanent, and where money flows without accountability, corruption flourishes. Like every sector in Africa that is plagued by corruption, foreign aid wasn't an exception. Officials learned how to game the system. A health report in Uganda in 2010 found over 200 ghost workers, names on payroll, salaries paid, but the people, they never existed. In Zambia, the Global Fund suspended over $300 million in aid after millions went missing. In Kenya, COVID-19 funds meant for PPE were siphoned and pocketed by officials. This wasn't theft by rebels or bandits. This happened in offices, in plain sight. So what happens when money comes in but doesn't go to where it's meant to go? When donor nations wire in billions to fight HIV, malaria, to build clinics, but the drugs never arrive. The clinics are built only paper, and the doctors are just names on payroll. That is a direct depiction of the situation. The African continent receives over 50% of global health aid, yet accounts for less than 10% of healthcare infrastructures compared to other regions. And this isn't just about missing money. It's about real people who show up at a clinic and get turned away. It's about a mother walking 20 kilometers to a hospital with her child, only to find out that there is no doctor, no nurse, no medicine, no help. Foreign aid into Africa went from a few hundreds of millions to billions. In sub-Saharan Africa, in 2000, it was $6.8 billion. By 2010, it had already doubled to $12.7 billion. In 2024, it stood at $36 billion. This is more health aid than any other region in Africa or in the world in general. Yet sub-Saharan Africa still has the highest maternal mortality rate in the world, revealing the disproportionate risk women face across the region. But everything led to this point.
Today, President Donald Trump calling U.S. aid fraud.
As President Trump calls for USAID to be shut down.
It's absolutely obscene, dangerous, bad, very costly. I mean, virtually every investment made is a con job.
When the President of the United States, Donald Trump, made an abrupt decision to terminate US aid, it was met with mixed reactions. Some African leaders like Paul Kagame reacted positively with optimism.
Completely agree with him on many things.
Even though it will hurt you as Rwanda, which depends on some US aid to fund your healthcare and development.
I think from being hurt, we might learn some lessons to, to do things we don't do that we should be doing. That's why I'm saying, yeah, it's aid thing, which I've never been a friend of it, much as I've been a beneficiary.
Some of the cons of aid is that it leaves Africa vulnerable to the political mood swings among funders. It also leads to loss of self-determination in terms of health priorities, as ultimately the funders decide and determine what the health priorities should be. That's why in some cases, aid tends to focus on a single disease, leading to a poorly integrated health service. But real change is beginning to take place. Some countries have started fighting back against this rot and inefficiency. A country like this is Rwanda, that has started paying workers using fingerprints. In Nigeria, companies have started making test kits. This not only needs to be encouraged, but must continue, as Africa's healthcare must be rooted in local content, capacity building, and sustainability, not relying completely on importation.